Thank you very much. We are thrilled to have you all here with us. Our topic tonight is advocacy in action, driving positive health policy change. I admit we are 2 weeks out from the election, and it can be hard to find positive things to say about our political environment right now, but I would love to start on a positive note, and Raj, you can help me with that. I'm curious if there are positive lessons that you've learned from this campaign when it comes to communicating health policy solutions.
Well, thanks, Sam, for the easy question.
Go ahead.
You know, I do think there, it's for a physician who had a chance recently to work in the White House, it's not always that every White House or every presidential cycle prioritizes healthcare. Sometimes it's hard to get on the agenda, but it's so clear that in this election that both parties are paying attention to people's healthcare. Of course, they have differing sides. I think that they're, in terms of their opinions, but having healthcare being front and square and center into the presidential election, I think is a positive thing because it also highlights the pain and the challenges people are facing when it comes to lowering healthcare costs. Of course, in the White House, we were working to ensure we lowered those costs by, for instance, ensuring people get covered for health care insurance. 21 million people, a record, are now getting Affordable Care Act, marketplace facilitated healthcare insurance. And I think, looking ahead, I imagine healthcare is only going to become an even more important agenda item for presidents in either party.
Lori, all kinds of industries right now are trying to communicate their message to voters, and of course part of what you do is communicate your industry's message to policymakers as well. I'm curious, as you think about the closing weeks of this election, what is Pharma trying to communicate to people?
That's a great question. Thank you for having me here. Our focus is really ensuring that we have an ecosystem that rewards and incentivizes bringing innovation and new therapies to the marketplace so that patients can access them and afford them as well. So we are focused on preserving that ecosystem so that companies can take the incredible risk that it takes to bring a medicine to market. Today, anywhere from 10 to 15 years at a cost of $2.5 billion to bring a new medicine to market. And that carries high risk. 90% of what our companies do fails, unfortunately, in the FDA process. And it used to be just getting your product approved was the success. Unfortunately, today, getting your product approved is really just the first step. You have to convince payers to cover your medicine and provide access to it to patients, and it has to be at a price that people can afford. So we're focused on all three. How do we ensure that the FDA regulatory process is working to allow medicines to come to market? Once they get to market, how do we ensure patients can get access to them, and can they afford them?
Ziad, let's move back a little bit in time. You're an expert in long COVID, and so not only do we have this context of this election, we have the context of our emergence from this pandemic. I'm curious if there are positives that you see that we're taking out of that period that you think we're actually continuing into the present and into the future.
Well, I'd like to always see the glass half full, and I think we've sort of in the past several years, we've learned a lot about long COVID. We learned a lot about how viruses can affect people and leave them with a long-term illness. And I think that looking at this positively, I think we need to leverage this knowledge, this information, this new understanding, and helping us shield the nation and proof it against the threat of future pandemics, and I think that's really going to be very, very important. I think the silver lining there is learning from the past, learning from the prior experiences, and making sure that we leverage those experiences and that knowledge to help us improve our response in future pandemics.
Is there an example that you see that shows that's happening?
I think so the vaccine story is really an interesting story. Really, we've developed vaccines here for COVID-19 in the U.S. at warp speed in less than 1 year. That's really a wonderful accomplishment. It's really showcased that when we put our mind to it as a nation, when we really sort of devote energy and resources to accomplishing one goal. We did that in less than 12 months, and you know, different views, you know, people have different views about vaccines, but the facts are that vaccines work and actually helped, you know, a lot of Americans avoid serious illness and death. And I think that's really a brilliant example of how, you know, policymakers could work with scientists to really, you know, save the day, pretty much, literally save the day.
Lori, your industry, our industry faces a trust crisis. And we have our own ways of thinking about it, but I'm curious how at Pharma and for all the drug companies and manufacturers you work with, how can you address this trust crisis?
Yeah, it's a great question, and you're right. I feel like any big institution, be it big media, big, you know, insurer, big pharma, faces a crisis of trust, and we're seeing that unfortunately play out. You mentioned vaccines. It worries me a lot that we're at an inflection point, in my opinion, where we've seen decreases in people's willingness to take childhood vaccines based on what I would argue misinformation in the system. That's really, really concerning. As an industry, you know, I hear a lot. I was just with my one of my oldest daughters this weekend at her college, and I was having a discussion with a mom that was there, and you know, she said to me, well, your industry isn't interested in actually curing disease. You just want people to be on their medicine for forever. And I said, well, you know, our industry essentially cured hepatitis C. Mm-hmm. We have a cervical cancer vaccine that not one young woman who has had it has progressed or gotten cervical cancer. We have medicines in development that hopefully will also be curative or preventative. You know, I'm worried that narrative or these beliefs that as an industry we're not interested in doing that take hold and take root with people. And candidly, as an industry, we need to do a better job, I think, telling our story, educating people about the importance of prevention, because to me, prevention is the best medicine. If we can prevent disease progressing, we will do ourselves much, much good. And that the industry is committed. I think the other thing that we've been trying to do as an industry is show up in different places. Loved the early panel where we talked about clinical trial diversity and ensuring that as an industry we're showing up in communities in different ways. There is a long history of mistrust that exists, and as a result, our industry didn't see the kind of enrollment in clinical trials that was representative of the population that our medicines are intended to treat. So several years back, we launched something with Yale, Morehouse School of Medicine, and Vanderbilt called the Equitable Breakthroughs for Medicine Development, EQB Med, and we're just now launching a number of sites in the Southwest. And the goal of that is to go to communities, establish sustainable models for clinical trials, and not just pack up and leave when the clinical trial is over, but be in the community, know the members of the community, so that over time, we increase representation in the clinical trials that our companies perform, but also to be part of a community. Because I think right now, oftentimes people think of the pharmaceutical industry and their companies in Massachusetts or New Jersey. They were nameless, faceless people. But we are in the community. We are doing clinical trials that so many people depend on, but we need to show up differently, and that is one step to trying to show up differently.
Raj, one of the things that we believe in at TIME is bringing together stakeholders from different communities. That's what we're doing in this conversation here. You've worked across, in your career, lots of different types of communities, research, government, corporations, and all kinds of different settings. It feels like within the medical community, it's so hard to get these groups to play together in a productive way. How do we solve that?
Well, I think first and foremost is setting very clear goals and objectives that everyone can see themselves in. So an example of this, when I was working in the White House, other than responding to COVID, I was leading the National Security Council's pandemic office, we also were in charge of figuring out how we better prepare the nation and the world for the next pandemic. Well, one of the remarkable things that came out of the science was the fact that we had mRNA vaccines faster than any other vaccine we'd ever had for any health emergency in history.
In less than a year.
In less than a year. And so
we can applaud for mRNA vaccines.
Yes, that's
absolutely, yes.
And so what we did was to say, could we go even further? Can we get a vaccine in 100 days to be emergency use authorized of the next pandemic. And that brought together the private sector, government, researchers, physicians, nurses, community health workers, all around a shared mission. Now, the second step, I would say, is to turn that into action. And one of the reasons I joined Flagship recently was because they're trying to take this idea of being proactive in the healthcare system. We have a sick care system. We've started to push forward a concept of preemptive health and medicine. The idea that we could imagine a company having as part of its mission, creating new companies that would improve, protect, and maintain people's health before they become sick. Variant-proof vaccines. One of the technologies that the companies are focused on, leveraging AI and leveraging this new ability to look into our cells and ask what is being dysregulated well before you have symptoms. This particular company has come up with variant-proof vaccines, mapping all potential future variants of, say, a coronavirus, and ensuring that our vaccines are better designed. So when you go and get a shot, you might have a better chance that vaccine is more durable and will protect you and your family.
So we have this vaccine revolution that we're living through. And Ziad, I think we're also potentially living through a revolution when it comes to chronic disease and how we think about it. And I'm curious what you see as the potential when it comes to thinking about how we can treat patients differently who are experiencing chronic disease.
I think one of the major insights from this pandemic is the recognition that viruses can lead to chronic disease, that viral infections can lead to chronic disease. And this has always been the case. We just didn't really recognize it. And I think COVID sort of put a very, very strong microscope on it. And now we see it very vividly. The pandemic has left at least 20 million Americans with chronic illness we call long COVID that can affect literally nearly every organ system. And I think that's really the key revelation or the key insight from this pandemic is really realizing that the genesis of disease is could be environmental, could be diet, but it could also be infectious agents, and realizing that is going to be very, very important and is key.
Lori, we're talking about all this innovation. How do we make sure it reaches the largest number of people possible?
Yeah, that's a great question, and it is a challenge, as you know. I think one of the biggest concerns that we've had over time is just the evolving nature of our insurance system. It used to be the case that when you got prescribed a medicine, you went to your pharmacy, you may have paid a flat copay amount, $25, $30, and you walked out of your pharmacy. I would say over the past 15 years, we've seen a lot of changes in insurance design. And now most people, even for their medicines, have a deductible. The average deductible for a family today is in excess of $2,500. When you walk into the pharmacy today in January and you present your prescription, the price that you are asked to pay for that is what's known as the list price of the medicine. It's not the price that our manufacturers receive. It's not the negotiated price that we negotiate with the insurance companies for. It's the list price of the medicine. And for many patients, that price causes them to walk away from the pharmacy counter because they cannot access and afford it. And that is a big, big problem in our system today. We've been advocating for reforms to ensure that when we negotiate discounts, that those discounts flow down to the patient when they show up at the pharmacy counter, because medicines do no good if they're sitting on someone's shelf. They don't help the patient, they don't help the healthcare system, and guess what? They end up in the emergency room often where care is much more expensive. So we have a lot to do in that regard. But we also have to think ahead about the types of medicine that are coming our way. The types of medicines that the future holds, cell and gene therapies, are likely not a pill. They're a medicine that's going to require you to go into potentially a hospital to get infused. And I don't think the payment system today is equipped to deal with what technology is coming. And so we really need to think as a country, how do we ensure that these medicines are available? What I worry about is if we don't figure the payment side out, it will dry up the innovation side of it. And when you look at some of what's in the pipeline, it's Star Wars-like in terms of the ability to change the trajectory of certain diseases. But the payment piece is important. The provider piece of it is really important too. When I think about the Alzheimer's medicines that today are rolling out, the average person today waits 6 to 9 months to be able to get in to see a neurologist. The medicines that are coming, that are being developed now, depend on early access to those medicines before you show symptoms. And the goal is taking them for hopefully a relatively short period of time, a year, year and a half. But if you don't have symptoms, if you don't have enough providers that you can actually get into care, what happens? So I think there are payment issues, there are provider issues, there's incentives in the supply chain that all need to be worked out. I don't mean to sound doom and gloom. There's a lot of work to be done, but the innovation's important, and I think it's worth fighting for.
You mentioned that conversation where someone said to you, "You're just here to profit,"
Yeah.
right? How do you convince someone that says you're going to be part of the solution when it comes to this cost problem?
Yeah. I would say, again, this is an area where I think it is often misunderstood that as an industry, when people think of our industry, they think of the big companies that have kind of made it. What they don't often hear and think about are a lot of the companies that you're investing in that may never make it to market, because this is an extremely risky business, right? When 90% of what you do fails, you have to convince an investor, invest with my company. I may not show a return for 10 to 15 years. On average, it costs $2.5 billion to bring a therapy to market. And once I get it, let's assume I am successful and get it to market, then I've got to convince a payer to cover it at a price that patients can afford it. And I get, this industry is a for-profit industry, but as investors look to make investments, they can just as easily invest in TikTok or the next social media change. They don't need to invest in this industry. I believe it's important that they continue to do so because patients candidly are waiting and needing those therapies. So, do companies earn a profit? Yes, they do, if they're successful, and that profit fuels the next generation of research and development for new medicines coming to market. And the ones that aren't successful, we never hear about because they fold and they're gone.
Thank you for that. Raj, we've been talking about this cost crisis for a long time. I was looking at a cover of Time magazine today from 1979 about the costs that Americans are paying for healthcare. For many of us in this room, this is a conversation that's lasted our lifetime. Mm-hmm. We pay 2 to 3 times as much as our peer countries, and our care is often worse. We've heard many examples of that earlier tonight. Please give us the Optimus case for how we can fix this problem.
Thank you for another easy question, Sam.
If you keep showing up to these events, that's what we do.
So look, there's not a silver bullet. You do need some of the policy reforms. I think there are many here who know about the $2,000 cap on out-of-drug costs for seniors in this country. That is something that makes a difference for those seniors. If you go to the pharmacy counter, we were just talking about this, and you know that at the end of the year, you're not going to be spending more than $2,000, you get more medicines. That's good for a lot of the companies you work with, and it's good for the patient. So that's one. The second thing I think, and this to me is perhaps the most optimistic, is that we have never had a problem in history that is as large as something like a healthcare cost problem, where technology doesn't play a massive role. And the good news is that we are at a convergent point between computational science, the latest take on it being AI and machine learning, and biological science. The advances we're making every day, I get to work with scientists and entrepreneurs at Flagship. The things we could do with science that we couldn't do when I was a 20-year-old miserable lab student pipetting, into little fluid into a plastic tray, that we can do now is extraordinary. So extraordinary that we can design an entire field to, again, focus on preempting disease before it happens. And just to give an example, there's a company that is in our portfolio called Harbinger Health. Its entire mission is to make cancer testing as easily as accessible as cholesterol testing is by making cancer tests affordable with an entirely new way of looking at the science of cells and DNA and how it circulates, to be able to arrest cancer, detect it, first of all, at stage 0 or even before it occurs in the body. If that happens, then things transform not only at a population level, but the conversation I have as a doctor changes. The conversation we have with relatives changes from, oh, they caught it too late. How many times have we heard that? To, they caught it early enough so that my father, my relative, my patient could get treated before they became hospitalized. So we have not yet seen the power of that technology to be proactively and systematically applied, both the cellular biology and the computation, the biological science and computational science. If we can get investments in this space, and we have extraordinary, kids of the year like we just had here, and shout out to him because I went to Hopkins as well, and it took me about 10 more years before I could ever say the things he even said as a 15-year-old. But I think when you look at talent like you just had, and the promise of that talent, when you pair that with science in computational science and biological science, and you put that together with capital, I think as long as the policies enable it, we're going to see some extraordinary revolutions. And we will be having people come up here and have their disease detected, whether it's cancer, Alzheimer's, colorectal cancer, much earlier than you ever had before. So to me, that's very optimistic.
Thank you. Ziad, we're talking about shifting conversations here. And I think one thing that's really important that shifted is our understanding of how some of these crises are intersecting and overlapping with each other. You work on environmental health, and I think one of the things that's emerging now is a really consistent conversation about how our health crises are climate crises and vice versa. I'm curious if you recognize that trend and if it inspires you.
Oh yes, absolutely. So really, the environment and what you eat really affects your health, but what you drink, what affects your health, but also the environment you live in affects your health, from climate change to air pollution to microplastics and other environmental hazards. And I think if we're going to take prevention very seriously, and I think we all sort of argue that prevention is definitely better than catching the disease late, we must pay attention to environmental determinants of health, air pollution, climate change, perhaps the most serious health crisis in the 21st century, maybe after the pandemic, but it's really a serious and growing health crisis that remains unattended to. So those are going to be very, very important to ensure the health of populations.
Lori, as we wrap up, what is one big idea that you want to take into 2025 that you're excited about when it comes to stories that you think are improving and the state of our health?
Wow, that is a fantastic question, and I'm going to piggyback on something I already heard on the stage, which is the power of technology combined with science. I do feel like we are at the cusp of a very revolutionary potential stage where we can take the power of technology and the power of science for the good to hopefully bend the cost curve to not only reduce the cost to bring a new medicine to market, but finding patients sooner, dealing with prevention, not waiting until diseases progress. I think there's so much opportunity and power there, but we have to have an ecosystem that continues to support that and a policy environment that supports it as well. And I worry sometimes that the ideology of today makes it hard for compromise. And to me, good legislation happens when both parties can work together, and that's become much harder, unfortunately, as time has gone on.
I think that's a great place for us to end this conversation. Ziad, Lori, Raj, thank you so much for joining us.
Thank you for having us.